This film has been created by St George's Hospital in partnership with the Can You See Me programme.
It brings together members of the community and healthcare professionals to explore common myths and misconceptions about cancer. These beliefs often come from culture, tradition, or experience, and while they may not always be medically accurate, they are real and meaningful to the people who hold them.
By sharing trusted medical knowledge alongside lived experience, the aim is to support communities to make informed decisions and help professionals to respond with empathy and cultural sensitivity.
There is a perception that the NHS doesn't give BME patients the same quality of care. Real or perceived discrimination leads to mistrust. Experiences of being ignored, not taken seriously, or given substandard care reinforce this myth. What is the NHS doing to address inequalities for the BME community?
As the Director for Cancer Services at St George's, I want to acknowledge the pain and frustration many Black and minority ethnic patients have experienced in healthcare. We understand that feeling ignored, not being taken seriously, or receiving substandard care is real and deeply matters. These experiences lead to mistrust, and we are committed to changing that. To truly address health inequalities, we must move beyond general statements and implement concrete, measurable changes. We're doing this by creating opportunities for BME patients to share their experiences directly with us. Your voice is shaping how we train staff, design services, and improve care. Improving cultural awareness. All our staff receive training to better understand and respond to the diverse backgrounds of our patients. We want everyone to feel respected and safe. Better representation. We're working to ensure our workforce, especially in leadership, reflects the communities we serve. Diverse teams lead to better, more inclusive care. Using data, we are analysing health outcomes by ethnicity to find where disparities exist and are acting on that data to close those gaps. Partnering with communities, we are building stronger relationships with local BME organisations and community leaders to co-create services that meet your needs. We know we haven't always got it right, but we are listening, learning, and taking action. Every patient deserves to be treated with dignity and fairness. Your feedback is crucial, and we are here to support you.
Some Caribbean cultures believe that putting your mouth on it or speaking about cancer makes it manifest or worsen. This stigma silences conversations or discourages early screening or help seeking. How can speaking about cancer support you?
There is a persistent myth that simply saying the word cancer can somehow cause you to get it, cause it to spread, or get worse. Cancer is not contagious, and talking about it won't make it happen. Cancer occurs when cells in the body start to grow in an unusual way. It's caused by changes inside the body and things in the environment, not by talking about it or saying the word out loud.
In fact, sharing your experiences and speaking openly about cancer can be incredibly helpful for your mental and emotional well-being. Far from being harmful, opening up can reduce feelings of fear and isolation, lessen anxiety, and help you to feel more supported and informed.
We know from research and experience that talking about cancer allows people to connect with others, access emotional and medical support, and gain strength from knowing you're not alone.
Some believe cancer is a curse or punishment, or trust solely in divine healing. God will cure me, delaying medical intervention. How does the NHS support faith-based care?
The NHS supports faith-based care in several ways, including providing chaplains from a number of different faiths and religions like ourselves. As chaplains, we are here to provide religious, spiritual, pastoral and culturally sensitive care to patients and their families. We have found that when fighting cancer, many worry that their condition is a curse or punishment. But most faiths teach us that we are living in a fallen world or imperfect world, and that actually hard times and challenging times can happen to anyone, regardless of how good or bad they might be. So from our experience, and likely from yours too, we can see that cancer can happen to even the best of us. We could all think of good people that have had really hard things happen to them.
As people of faith, many of us believe in divine healing. We believe divine healing and medical interventions can go hand in hand. When the medical field can't help, we often ask God to intervene, and where the medical field can help, we ask God to work through them and to help all to go well. Occasionally, we find that some people want to only trust in supernatural healing and therefore delay medical intervention. But our experience and research show that early medical intervention and treatment save lives. We can trust God and faith and say yes to medical intervention at the same time. We can ask for divine healing, use medical treatments, and put our faith in God.
There is a mistrust of Western medicines. Historical injustices, for example, Tuskegee, Pfizer in Nigeria, and ongoing systemic racism have fostered deep mistrust in BME communities, especially around clinical trials and hospital treatments. A fear of being used as guinea pigs is still prevalent. How can we dispel these fears?
Mistrust comes from the real historic injustices like Tuskegee, and this has to be acknowledged. Today, research involving people requires approval from the relevant Research Ethics Committee and the Health Research Authority, the HRA, providing together a national framework and coordinated system for review. Depending on the research, other specific bodies like the Medicines and Healthcare Products Regulatory Agency, MHRA, may also need to provide approval. Researchers also now work directly with communities, holding spaces like research cafes to promote health literacy and community engagement. They also offer translated information sheets and partner with local trusted leaders. By being open, respectful, and inclusive, we can build confidence and show that research is done with communities, not on them.
There is a belief that herbal or natural remedies can replace conventional treatment. This can lead to dangerous delays in care. Is it safe to take alternative medicine while having treatment for cancer?
Many people believe that herbal or natural remedies can replace conventional cancer treatments, but this belief can lead to dangerous delays in getting the right care. It is important to understand that these remedies should not replace conventional cancer treatments. Western medicines, backed by scientific research and clinical trials, offers the best chance to control or cure cancer. Herbal or natural remedies may feel safer, but these are not backed by research and we cannot guarantee their safety. Some herbal or natural remedies can interact with cancer medicines and reduce their clinical effectiveness or cause harmful side effects.
However, we understand that some herbal or natural remedies have deep cultural traditions which should be respected. Therefore, some herbal or natural products can be used safely alongside cancer treatments, but only under careful guidance by your medical team. The key is ensuring there are no harmful interactions with prescribed medications and that these remedies are used safely. In summary, while herbal remedies are an important part of many cultures and can sometimes help with symptoms, they should never replace conventional cancer treatments. Always talk openly with your oncologist or pharmacist before adding these supplements or herbal products during cancer treatment.
Lack of awareness about asymptomatic cancers leads to late diagnoses. BME communities often don't speak openly about cancer, and minor symptoms are sometimes dismissed. What should people do if they have worries or concerns about cancer?
You don't have to have severe symptoms to have cancer. Some cancers can develop quietly without notable signs. Waiting until things get worse can mean the cancer is diagnosed later when treatment is more complex. Many people think you need to be really unwell to seek help, but if something doesn't feel right or you notice a change, don't wait. Speak to your GP early. It may be nothing, but it's important to get it checked out. It's also really important to attend screening appointments when you receive these. These checks can pick things up early before they become dangerous. We know that for some communities that don't always feel seen by healthcare, it can feel really hard to reach out or attend appointments. We hear you and we want to do better. We're here to support you and make sure your health matters.
If a patient's beliefs are dismissed, they may feel excluded from decisions about their own care and could become less open with their healthcare team. For example, someone who believes in herbal remedies may stop taking prescribed medication without telling their consultant, which could have a serious impact on their treatment plan. That's why it's vital to listen, acknowledge, and build trust.
This film is not a replacement for talking to your medical team, but we hope it encourages open conversation. We would like to thank everyone who contributed their voices and their expertise.